Hello, I'm Dr. Ilango Sethu, Transplant Surgeon at Royal Care Super Specialty Hospital at Coimbatore. Today's video, we are going to discuss how we do the liver transplant operative procedure and what you should expect in the first few days after your liver transplantation. Liver transplantation is a very major operation. It is done by a team, not by an individual. There are lots of key members. Normally, there are about 2 to 3 surgeons involved in the transplantation procedure. There are 2 or 3 anesthesiologists. There is 1 hepatologist and a large number of nurses and paramedical staff involved in your care. The liver transplant operation is an open operation. So today, I'm going to tell you about the recipient operation. The recipient operation is usually done as an open procedure in which we use a T-shaped incision or a rooftop incision to open the abdomen. Sometimes thinner individuals can make do with a smaller incision. Once we go inside the abdomen, we remove the old liver and we put in the new liver. The old liver removal is the key part of the operation because the pressure inside the liver is very high and the blood clotting parameters are abnormal. This part of the operation is considered to be the most difficult and possibly dangerous part of the operation. We divide all the attachments of the liver, and then the liver has got blood vessels that supply the blood to flow through the liver, which is of 2 types. The portal vein, which takes blood from the intestines and your digested food towards the liver, and the hepatic artery, which takes the blood from the heart to the liver. So that takes the oxygenated liver. These all go through a certain portion of the liver called the liver hilum, and the job of the transplant team is to remove the connecting portions from the liver hilum and remove the liver entirely. The liver is connected to the main vein of the body called the inferior vena cava on the back side through 3 hepatic veins and a variable number of small veins called short hepatic veins. The surgeon will remove all these veins as a part of the explant operation. We usually shift the patient back to the transplant ICU on day 1, and on day 1 we do some blood tests to find out how the liver is accepted by your body, and we also do scans to find out how our connections are working. Either there is a leak or a block. So this is the normal course of events, so that at the end of 1 year the patient becomes completely normal, returning to productive and active life in the community. Obviously, there are many complications that can occur in a liver transplantation. The risk of death in a liver transplant patient in 1 year is about roughly 10 to 15%. If there are any questions, so feel free to ask any questions that may be in your mind after seeing this video. Thank you.